This video is about reporting local infectious disease cases, presented to you by the St. Mary's County Health Department. Importance of reporting infectious disease. Reporting infectious disease is crucially important. The purpose of reporting known or suspected infectious disease is to ensure the proper identification and follow-up of cases. Prompt reporting of known or suspected infectious disease allows time for local health agency to interrupt disease transmission, locate and prevent or treat exposed contacts, identify and contain outbreaks, ensure effective treatment and follow-up of cases, and to alert healthcare community. So what are some examples of infectious diseases that need to be reported? These include Lyme disease, measles, meningitis, pertussis, also known as whooping cough, rabies, sexually transmitted infections, and hepatitis. These are just some examples of reportable diseases. For a detailed list of infectious diseases reporting, please visit the St. Mary's County Health Department website at www.smchd.org/infectious-disease. So if you were to go onto the St. Mary's County Health Department website under Infectious Disease Prevention and Control, this is how the page will look like on your screen. If you click where the green arrow is pointing at that says "Click here," you should be able to find the full list of reportable diseases. This is how the list should appear. Please note that each disease and condition has a time frame for reporting. The time frame should either be immediate or within 1 working day. Who should report infectious disease? These include healthcare providers such as physician, physician's assistant, dentist, chiropractor, nurse practitioner, nurse, medical examiner, administrator of a hospital, clinic, nursing home, and any other licensed healthcare providers. Public, private, or parochial school, child care providers, owners or operators of food establishments, any individual having knowledge of an animal bite, or laboratory directors. How to report infectious disease. To report infectious disease cases for healthcare providers and laboratory directors, please call in or submit a form to Health Department in regards to reportable disease that needs to be reported. To report infectious disease cases for schools, child care providers, and others who are required to report, please call Infectious Disease Control at St. Mary's County Health Department at 301-475-4330 or after hours at 301-475-8016. So this is for healthcare providers. To report a possible animal bite or exposure, call the Health Department at 301-475-4330 and submit Maryland State Form number 4206 to St. Mary's County Health Department via mail or fax. The possible animal bite or exposure form can be found on the St. Mary's County Health Department website. Simply click where the green arrow is pointing at that says Maryland State Form number 4206 and you should be able to find the form. To report a Lyme disease case, submit the Lyme disease case report form to the St. Mary's County Health Department via mail or fax. The Lyme disease reporting form can be found on the St. Mary's County Health Department website. Simply click where the green arrow is pointing at that says Lyme disease case report form and you should be able to find the form there. For other infectious disease reporting, please submit Maryland State Form number 1140 to the St. Mary's County Health Department via mail or fax. However, please note to not fax if reporting HIV or AIDS cases. Other disease reportings can also be found on the St. Mary's County Health Department website. Simply click where the green arrow is pointing at that says Maryland State Form number 1140 and you should be able to find the form there as well. For laboratory directors, there are 3 different lab reporting forms. For infectious disease reporting other than HIV or CD4, please submit the reporting form number 1281. For HIV or CD4 reporting, please submit the lab reporting form number 4492. And for CRE case reporting, please submit the CRE case report form. All these forms need to be submitted to St. Mary's County Health Department via fax. Laboratory report forms can also be found on the St. Mary's County Health Department website. By clicking where the green arrow is pointing at that says State Guidance, all lab report forms can be found there. By clicking onto the link that says State Guidance, this should be the link that appears. Laboratory directors should use this reporting form to submit to the health department. Provided are the contact information for disease reporting. If you have any questions, please call into the St. Mary's County Health Department. Our phone number is 301-475-4330. Thank you very much.